Hi everyone, good morning. Good morning everyone. I'm Szenan from Center of Balance, the acupuncturist and Chinese medicine herbalist. Welcome everyone. If you're online now, watching this live video, please give me a thumbs up and tag your friend into here, because our topic today is about neck pain treatment. Neck pain treatment. We're going to talk about acupuncture. We're going to talk about medications. What can you do when you have a neck pain? What treatment should you go for, right? Then tomorrow we talk about what can you do at home for neck pain, which I'm going to show you some acupressure points for neck pain. But today, for acupuncturists, you're gonna learn some strategy for neck pain that will instant relieve neck pain, right? And we'll talk about medication as well. Okay. Now, if you're on this live video, please give me a thumbs up, then share. If you're on Facebook and Instagram, share this video, share this live video. Now, if you know anyone suffer from neck pain, or if you're a practitioner, you know your colleague who need this knowledge, so please tag them into this video. Okay, that's it. I'm not wearing my glasses today because my glasses is broken. Was broken this morning when I wake up. I accidentally land on it. I put it aside my bed, but I land on it and it's broken. But I have another pair of glasses. I just don't know where it is, where they are at the moment. So go live without my glasses. It's probably the first time, isn't it? Right. If you're on Facebook, if you're watching the replay, please on Facebook and YouTube, you can fast forward, like speed it up for 1.5, 1.25, something like that, so it'll be faster. Okay, let's start straight away. Neck pain. So we talk about neck pain. We had talked about neck pain causes. We talk about what neck pain, and we talk about neck pain symptoms. So the symptom is not just pain, right? It can be stiffness, it can be limitation of range of movements, right? So these are all important, very, very important to know. It can be tingling and numbness down to your hands, right? It can cause this, and it can you may get stiffness in your chest or tightness in your chest, or difficult to breathe, right? Difficult to breathe, right? Severe neck pain. If it's severe neck pain, and we talked about yesterday, because most people, when do you see a doctor? Mostly people will just leave it. If it's small pain, leave it for 1 or 2 weeks. But we suggest if it's not a severe one, when you leave it for over 1 week, then that's not resolving. It's not reducing itself, the pain. You should find a practitioner, acupuncturist, or your doctor to consult what's going on with the neck. Okay. Hello, how are you? Nice to join. I can't see who you are on some platform. Please say hello to me so I know who you are. Okay, I can see that Nida in here, Eric in here, Alison in here. Good morning. It's Monday. Amida in here. It also can cause vomiting or nausea. Yes, when the pain is very severe, it can cause vomiting, neck pain itself. But even though I mentioned about meningitis. Meningitis is the brain issues, right? It's an infection. Then it can cause fever as well as vomiting and stiffness in the neck. Right? That is us. This is something that is serious. It's something that's serious, and it might kill this person, this patient. So straight away go to emergency. But I tell you what, to practice in New Zealand, I never seen this case. To be honest, why is that? Because when it's fever, when it's neck pain or meningitis case, they all go to emergency already. So you may not necessarily see all this patient, but you need to know about it. What if they come to see you? What if that is your family? Brajo, nice to meet you. Marcelo, very good, thank you. An afternoon over your country. Okay, great, good to know. We are in the morning. Now I actually went to Auckland to visit a master who does naval acupuncture. There's a needle over here. We call it 九宫八卦 acupuncture method. 九宫八卦 acupuncture method. Okay, I did that acupuncture too. I learned from him for a while, and now I went to Auckland and visit him and asked him to teach us. And he agreed with that, and he is preparing for a Chinese webinar. Let me talk to him about whether he can do English webinar. He been doing some over the years, English workshop, but I need to see whether he has got the material on the English. Okay, if he does, but we'll probably spend some time to help him to do all the English material. Then we will organize one webinar for everyone, okay, to introduce 九宫八卦, how to needle navel. I know when you hear about navel acupuncture, that you should not needle navel, because this is in the acupuncture textbook. It says you're not allowed to needle here, right? That's not true. It's that you can't needle straight away, but you can needle sideways. The sideways is different, right? We're needling the sideways, not going needle straight away into the tummy like this. You needle that, and you only need small needles. You need big needles. Okay. Let's talk about neck pain treatment. Okay. So how do you treat? So what people get neck pain, they will get some painkiller themselves, right? Over the counter. Just go to the counter. I can see that the Nurofen, and here you can buy Nurofen and aspirin and all this medication that you can take is common for that, right? But if you see your doctor, you must tell your doctor what have you been taking, any painkiller, and whether there is any injury or spot. If you're an acupuncturist, you need to ask them. And then you need to, when it comes to treatment, no diagnose, no treatment. So diagnose first. And how do you diagnose? Collect informations, by looking, in Chinese medicine, smelling, by touching, palpitate the neck. Go to that and palpitate the neck area on both sides, or the muscle and the bone, You know, is there any lump on it? Is there any bone that is going to one side or the others? You know, you need to find out all this information and ask the patient whether they have been any treatment, any sport that may cause this neck pain. Alright. Then what else? Do the range of movements. Get the patient to move hip from side to side. Any restriction of the range of movements, any pain when they move to one side or the others. Some patients need to stop and hear, oh, it's painful. It may pain in here, it may pain in here. Or on that side, it's good. Or it may still painful, but the range of movement is fine. They can do it. But the other side, oh, I can't go any further. It's so painful. You know? It can be like that, backwards and forward, and all these important things that you need to test out. And what else? Compress while doing this. When doing this, I try to see whether the vertebrae will compress the nerve. Okay, where there is a nerve function as well. And you lift the head up like this. So our test is, if they get tingling, numbness or pain in here, it can be pain just in your neck or tingling, numbness associated with tingling, numbness in the hand and fingers, and you tap on the head, it actually gets worse on one side or the others. Okay, now if you just lift the head up, you know, lift the head up. How do you lift the head up? Go like this and pull to the ceiling, to the sky. Then they feel better because the vertebrae is not pressing the nerve, and they feel better straight away. Then now you know it's actually compressed the nerve. This case, okay. And some of them, they will, when you ask them to move, they move a certain, oh, I can't move, I've got dizziness. Okay. That is when they move the neck, move to certain position, they actually narrow or compress the artery. So our brain, we need blood flow, we need blood supply for the brain, right? Now if you move to certain position and it compress the artery, so the artery become narrower, not enough blood go up there, and you get dizziness. So that's another type of neck pain. So we need to know all this. Okay, there are a lot of other type of neck pain. Okay, and we will talk about in the future about what type of neck pain and what do they present, what symptoms are they, and what tests should you do. Then we're gonna also talk about what treatment can they receive. Some of them they need surgery, some of them they just do acupuncture and tuina and no problem. Okay, now a lot of cases you don't need surgery unless that is accident, broken, fracture. Okay, and then you need surgery straight away. What I just mentioned, dizziness, tingling in hands, pain severe, causing vomiting, but definitely not meningitis, and all this pain that I just mentioned, acupuncture and Chinese medicine may help, may get them to normal. Okay, and it depends what technique you do and what strategy you do, right, and how severe they are, and how good is your technique, so all this is important, right? Now so diagnose first. Okay, apart from physical examination, you can get some idea about what's going on in the neck. But if you suspect that, okay, there's a bone issue in there, it might be the disc problem in there, what is the best way for them to go? Go for X-ray, go for CT scans, go for MRI. right? And so this is further to get the test to look at the structure issues, to look at the structure issues, and those examination can tell us whether there is any broken fracture, the disc pop out and compress the nerve, or the spinal cord is very narrow that actually compress the nerve as well, the root nerve, so it causing the problem. So we need that, the technologies to help us to diagnose. And I want to mention that this technology is not just something that Western medicine allowed to use. No, we acupuncturists, we allow to use those techniques. But it doesn't mean that when you use this technique, you're not an acupuncturist, you're not a Chinese practitioner. No, that's not right. Okay, it's just a method to help you assess to patient. You can look at big picture rather than just according to the symptoms. You see, according to the symptom, right? And blood test. Why blood test? Because some disease causing the neck pain, so you need a blood test to rule out metastasis, right? Right. Now, medication. So what treatment then? People will take medication, pain medication, right? So, and we talk about a lot about medication in the past, like Nurofen, what else? Aspirin, naproxen, yeah. All this medication, codeine, Tylenol, all this medication are common use on neck pain, right? And some like Tylenol you have to get a prescription, but the others you may not getting any prescription. It's by over the counter, right? All this medication, the side effects is stomach pain, bloating, it may give you acid reflux, it may give you constipation and diarrhea, right? Constipation and diarrhea. Most people, what I see, most people get constipation. Some people do get diarrhea from it. So you need to understand the side effects. And some of the pain medication you can't take it, especially the prescription one. Sometimes the doctor will need to know about whether you or your patient had any liver function issue or kidney function issue. They won't give you some medication. What does it mean? It means that it will have a potential to causing kidney function and liver function, and the side effects of liver function and kidney function problem. Then what else? Good morning, Li Lu. How are you? I'm good, thank you. So what else? What else then? The medication that you take, painkiller, okay? I always suggest my patient put a heat pack on the neck. If the neck pain can minimize the pain, use heat pack rather than medication. Okay? So this is what I suggest my patient. You heat pack, and some people use hot pack, ice pack, and that's okay too. Depends. I know in Chinese medicine we always tell patient to use heat pack. I do too, but I always tell my patient, try heat pack and see whether you feel better or not. If it doesn't matter, or if it doesn't get any better, you don't get any reduce, reduction of the pain. If you get worse, or it just you don't get any, not necessarily getting worse, but it just not feel much different, then what else? Use ice pack. Do the opposite. Use ice pack, and you may feel relief. If ice pack feel relief, then use ice pack. Right? Sometimes we use both, especially from the injury. Right? We normally suggest patients to get ice pack in the first 24 hours. But some other doctor, new research say, the Western one say, sorry, don't use ice at all. Just continue use heat. Right? Then my experience is, I just ask patients mainly use hot heat pack, but the patient need to know whether the heat get them worse or not. If the heat get them worse, change to ice pack. Right? Because according to Chinese medicine, when the blood flowing well and then decrease the pain and help it heal. So we use heat pack more than cold pack because heat can help the blood circulation, but they are different cases. Because some patients have infection and that is very hot in that area, and you need to decrease the infection. Sometimes cold would help too, because we don't know what kind of infection. Because infection according to Chinese medicine, it can be heat infection, it can be cold infection. When heat infection, we use cold. When cold infection, we use heat. You see what I mean? Yeah. How this medication interfere on pulse? I don't know. Okay, because my pulse is different. I don't actually get pulse to tell what the medication, how they do that. And even though the medication interfere with the pulse, and I just straight away what I got from the pulse and I treat it. I'm pretty sure it will interfere with pulse as well because it interferes with the organs, right? Yeah. So yeah, keep talking about medication side effects. Medication side effect, it can be giving you skin itchiness. When it comes to say, wow, give you skin itchiness in redness, means it can attack your lung as well, because lung control skin, and it may give you blurry in your eyes. What does it mean? Liver again, because liver control eyes. It may give you ringing sound in your ear, tinnitus. What does it mean? Kidney, right? This is how Chinese medicine read the symptoms, because the organs control all the entire bodies. Okay, so scientific medication, it can have the kidney function problem, liver function problem, lung function problem, stomach and spleen function problem, all these organs. So you need to just, I'm not saying that you're not allowed to take any medication for pain. Now I'm saying that if you have the choice and you can manage the pain with heat pack, I'd rather you do that, and I would strongly suggest you do that, and without medication, right? Without medication. Now, then you say, well, if the heat pack, cold pack is not working, what can I do? Yes, we will suggest some acupressure point. Then I'll introduce you tomorrow. If you're patient, tomorrow we're going to talk about acupressure point that you can do at home, right? There's something I want to give it to you, and some exercise. So where do you get exercise? See your physiotherapist. Now I will tell you, an acupuncturist, like where we study in China, we study and 3 now, including some of the exercise and acupuncture as well. You know, the test exercise, you can do those stretch of the exercise, especially while the needle is in. Okay, and yeah, but physiotherapy are more professional in exercise, to be honest. So yes, sometimes we refer them to physiotherapy, or sometimes just show them some exercise itself, or using the needles. So it's a severe one. The pain is very severe, and one other option is patient will get cortisone injection directly on the neck. Okay. Cortisone is a steroid, cortisone steroid injection. Right? It can help a lot. It can help, but in some cases it doesn't help at all. So we never know. So who knows whether it helps or not. So if a muscle problem, you know, strain muscle, so some muscle relaxant medication, it will help. But again, it comes to side effect as well. Okay. Now, antibiotic might help. Why is that? Because if the neck pain stiffness that causing from infection, so antibiotic will help. Okay. Now, you may need to straight away go to the emergency if the neck pain is causing from heart attack, if the neck pain is causing by metastasis, then they have to straight away go to the hospital. Maybe surgery. For what? For neck pain? Yes. If it's a fracture, surgery. Straight away. Don't come to acupuncture. Don't go to chiropractor. Don't go to physiotherapy. You won't ask your patient to come to see you if they have a fracture. If you say, well, come after your surgery because your fracture. You know, don't be silly. Oh no, acupuncture can treat everything. I can help everything. Come in. I'll treat you with fracture of neck. This is not what we do. Right. Treat them afterward. You know, and they may see physiotherapy and you. Okay. Now, more and more physiotherapy do acupuncture. They do dry needling. It actually helps as well, and we do dry needling as well. But some patients will still want to come and see us because what we do different. What we do acupuncture differently. Okay, we're not just dry needling, Okay. Now, what we just mentioned, all this treatment that you may need, that you may think of, refer to if you're an acupuncturist. Now, other treatment is chiropractor, osteopath, physiotherapy, or massage therapy. It would help neck pain too, right? You can use tense machine to relax the muscle too, right? And one other thing that what I do a lot, acupuncture, because I'm an acupuncturist, right? Now it's the time. I know we have a lot of, hi Joe, Veronica. Veronica said, my husband said you are a very good, honest, and generous doctor. He works with me sometimes to present this. Thank you. Hiya Joe. Joe is from UK. Oh, nice and good to know you're from UK. I haven't been to UK, but one day I'll go to UK. Okay. Thank you, Veronica, and thanks to your husband. Okay, let's keep talking about acupuncture now. So what? Acupuncture. They are, well, if you're patient right now, you're on my Facebook page or my YouTube, my clinic page. Now you watch this. We're talking about acupuncture, right? Now it's more for practitioner this time, but tomorrow we talk about acupressure point that you can practice yourself at home. Okay. Now, so you see this suction cup can be used in any of these cases. Yes, yes. Marshall, suction cup can be used for these cases as well. Yeah, because what happened is the neck pain normally comes to here. So cupping is a good method. You can do here and here. Some small cup you can do on the neck as well. In the middle, 大椎 point as well. Okay, so we're talking about acupuncture, but I'm going to talk about guasa as well. And guasa is acupuncturists can do that. Alright, can do that, and it doesn't take long. It doesn't take long. About 3 minutes, 5 minutes, you know, or even up to 10 minutes if we wanted to. It is simple. And I remember my first neck pain episode, and I didn't see any doctor, and I couldn't move my neck. I had to do this. And who did the treatment for me? My mom. And how did my mom do that? Is my mom an acupuncturist? No. Is my mom a doctor? No. She's just a ordinary person. This is a mom. She's a mother. But in Chinese culture, we know from the generation to generation, they teach, our family teach, when we see family people do that when people get sick, and they just put some oil on and just scraping on the pain area, and that's how my mom fixed me. Straight away, I got better. Straight away, I can move my neck better, and the next morning, I may move freely and no pain. You know, that's so it works very well, and it's the things that patient can do themselves. That some people can do that, and it's not hard at all. It's not hard at all. Okay, and I can't think of any dangers for that, because you're not doing very hard. It's just on the surface. So acupuncture can do that. But we have, this is saying that you can, if neck pain in here, you can just do it on where the pain is. Guasa. Okay, scraping. You need something to scrap it off. And we use teaspoon. Way back there we use teaspoon, but not the metal one. Not the metal one. They use the what do you call it? I can't remember. I think Veronica know that. I'm pretty sure in Malaysia we all have those teaspoon. A big one, a Chinese style teaspoon, not the European one, not the European teaspoon. Okay, not what you use right now. And the Chinese one, it is very soft in the edges. You know, it's not sharp at all in the edges, and that's very good for one of the best thing for guasa. Yeah, ceramic. Yeah, ceramic. 陶瓷. Yeah. Okay. Good. Let's have a look. Yeah. Ceramic. That's the right one. And they are very good for it. Okay. Use a ceramic one. So if you haven't got the one of the reasons that I don't use the proper guasa material, because a lot of them are made out of the animals products. Okay. It's made out of buffalo horn, you know, and I don't use animal products, because what I believe in, you know, one of the greatest acupuncturists and Chinese medicines practitioner and Sifu. For guasa, I use horn or Jar. Yeah. Yeah, jar is pretty good. I will use jar, but I won't use horn. It were a present from my master in China. Yes, yes, yes. It's very common to use buffalo horn. Okay, very very common. But I personally won't suggest you use that. I won't, because if you understand all the energy thing, you won't want to use it. But in the traditional way, use that one. Okay. Why is that? Sun Si Miao. Do you guys know about Sun Si Miao? One of the greatest Chinese master, medicine master, and acupuncture master, Sun Si Miao. He lived up to 100 and something years old, and he was a vegetarian, don't kill. Now I know in Chinese medicine we use a lot of animal product, right, as a herbs, and we use it. He said you don't kill a life to save another. You see what I mean? He said you don't kill a life to save another. That's what he said. Which means you don't have to use any more products, herbs, to save another life, because you have to kill them. He said he only uses it when they die naturally. So he won't go and purposely kill them and make it into herbs to feed patients. The same thing in here. Horn. He is right? Horn. What horn made out from? You have to kill the animals to make the horn. And I'll tell you, my mom, people will say, well, this horn is better, it's good, better results. I don't think so. I don't think so. I always say something to my patient. I say, well, if animal got killed, would they be happy for kill? If you kill them, when they die, would they be happy? If they're happy, that's great. You can use the things because they're happy. Because when they die, they're happy. They have the good energy in the body, whatever in the body. If they fear, or if they fear, or if they're scared, or if they worry, and the hormone start to imbalance, and the hormones is in the blood, so it will still stay in the body. That's why when you eat them, you get emotional problem. Okay, I have a case like this, and I didn't know that. My patient told me that. My patient told me that. I didn't have this information. None of my master told me about this. None of my master told me about this. And I figured out myself from my patient. Alright, that's out of topic. That's it. We talk about the acupuncture. Now acupuncture, we need to know something. A neck problem, right? A neck problem can down to the arm, down to the shoulder. So now we know neck. If you use balance method acupuncture, there are 12 major points that you can choose to use. There are local balance you can do, right? Local balance is you can do here. What is this? This is small intestine whole C. It's called small intestine 3, right? Small intestine 3. I'm pretty sure I'm right. Small intestine 3. That's very good for neck pain. And large intestine 3 as well. Large intestine 3, 三间. So between here and here, you put 1 needle, 2 needle, 3, 4, 5. You see what I mean? 1, 2, 3, 4, 5. Neck 5 points. 颈五针 in Chinese. Neck 5 points. Now you can massage those points as well to help neck pain. Any kind of neck pain. Doesn't matter pain is in here, in the middle, or in here, or in the front. Anything, which means it can treat sore throat as well. which means it can treat thyroid issue as well. Anything on the neck, those 5 points. This is local balance. This is local balance. Alright. What about global balance? There are other strategies as well that we know. This ankle can treat neck. That we know the wrist can treat neck as well. Now, if you do, here you go, 3 in, 3 yang, which is 3 in point on the wrist, 3 yang on the wrist, 3 in on the ankle over here, 3 yang on the ankle over here, 3, 3, 3, 3, 12. Each meridian, 1 needle on each meridian. What does it mean right now? This is magical 12 of neck pain. I did one webinar for that. You know, I did one webinar, and I did one webinar for 5 back pain and magical 12 back points. And you guess what? I had students in China. They just attained the free class and used the 5 back point and magical 12 back point treat herniation disc, lumbar herniation disc, and that case was severe because pain very severe and can't control bowel motion and urine. And normally, if you can't control bowel motion and urine, you go straight to surgery. And he told me that he fixed it. But of course, not just with this strategy. Okay, he also give him Chinese medicines. Okay, so I don't want to make you have a wrong send a wrong message to you. But he told me that in that case, as soon as you put needle in, the patient can stand up and walk. And after a week, much better, and 2 weeks, normal. Acupuncture with Chinese herbs. Okay, and he said that acupuncture help a lot, reduce the pain straight away. But this is just one of the strategy you can use for lumbar. It doesn't mean all the herniation discs that you can fix. You can make them all better with this strategy. Okay, because some structural problem that when you go to when we went to Dr. Tan's workshop, and he told us that balance method acupuncture has 3 things that doesn't work well. One of them is structure issues, which means herniation disc issue is a hernia, is a structural problem. So acupuncture doesn't work well. Balance method acupuncture doesn't work well. And to be honest, all other method of acupuncture doesn't work very well for structural issues. But it doesn't mean it doesn't work. It just needs to take more time, and the pain keep coming back. It's much harder to work on. But in some cases, like this patient, this French student has told me that straight away get immediately relief, even with structural problem. So now, I haven't got anyone report to me that, oh hey, the medical 12 of neck point and neck 5 point, I have successfully treated herniation disc problem in the neck. No, I haven't got this yet. Okay, but you know, this is the strategy, one of the strategies you can use, and it treat. So what I show you is it can treat all the pain. It's a quick and dirty way, we call it quick and dirty way. What do you mean? You don't have to go to diagnose what's going on. No matter what's going on coming in, you just put medical 12 neck point and 5 neck point. A bit more needles, but it helps all the neck. Now I want to mention that not just in the wrist, you have to come back to here as well. So about 3 or 4 finger above here, that area. Sometimes you need to cover this area. For what? You need to palpitate whether there's any sensitive point. If you need a 12 magical point, 12 magical neck point, it doesn't work well, or it works, there's still some pain, then you have to come back to here, this area, to get all the meridian, to get the access point, the most sensitive one, and put needle in. Same as in here. I would suggest you just do on the hand, on one side of the hand. I normally choose it on the in meridian, much easier to work on. Okay, you can choose young, do on one side. If it works and it's all free up the neck, that's it. You don't have to do anything. Now, if that's still there, how do you do that? Go to the other side of the hand and do the same. If that's on the young meridian, then come back to 3 or 4 finger above there and get the access point and needle. If that, oh, even much better, then come to the ankle. You can do the same. If it's much better and you think, okay, I don't need to do more needle now, just leave the patient and they may feel better afterward while the acupuncture there, right? And one other thing is, when it comes to neck problem, a lot of time is the range of movement. When they move the neck, it bring more pain. Patients sometimes don't feel pain, or they feel fine now, and when they go for exercise like this, and they feel more pain. When they feel more pain, this is one of the strategies that important to let you know. Let's say this patient got much better, like I put needle 12 magical point or 5 neck point in there, then oh, I feel much better now, pain just about all gone. Right? Yes, patient. Now can you move your head from side to side? Okay. Oh, that's still painful. This is fine. And now in this cases, ask the patient what meridian is that. Then if it's on the Taiyang meridian, you can go to the needle on the Taiyang point. What is Taiyang point? Hand Taiyang, small intestine, foot Taiyang. Foot Taiyang is UB bladder meridian. So you can choose the needle on the bladder meridian or Taiyang small intestine meridian. Just go slow and gentle, twist the needle. If the patient feel pain, don't do that. Choose other point. Otherwise, just gentle and ask the patient to move. Patient can move here, right? Move there, feel the pain, stop there, and come back. And move, feel the pain, stop it. Okay, and keep moving to that area where the pain is. And that will free up the neck. Right? This is extra for you, not just acupuncture, and with 动气, with 导引, this is 导引. Or alternative, ask patient to tap, use the hand. While you're still with the needle, you may still with the needle on the feet. It's quite far away from the neck, right? So while you're still with the needles, ask the patient give the tapping on where the pain area for about 5 seconds or 10 seconds. Just tap it, or just give it some massage like this while you're still with the needle, and then ask them to move it. And you will find that this technique from the based on the acupuncture, while the needles there, they won't get any relief. Most of the time they won't get any relief if they just do it themselves or do this, they won't get. But because the needle's there, then they tap themselves, they keep moving this way, and they find, oh, the pain's gone. Most of the time, try it and let me know whether it helped or not. So this is my strategy. I know that working now, but the range of movement is not increasing, or with pain still with the movement, then further on do this technique called 导引 or 动气. And this is very important. Very important to note this, because people say, most acupuncturists say, just put needle in and keep twitching the needle and do strong stimulation. stimulation. You don't need to create strong stimulation for your patient to increase the pain, the suffering from the needle pain. You don't need to do that. Just gentle, always go gentle. Right? Does it make sense to you? Veronica say thyroid. Is this hypo? Or both? Any thyroid problem, Veronica, any thyroid problem. Doesn't matter what's going, whether it's hypo or hypo. Don't matter at all. Because we are treating the meridian. We are not talking about whether it's excess problem or deficiency problem. There's another strategy. What I mean there's another strategy is there are many strategies, and acupuncture and balanced method acupuncture, if you do image, we are not discussing about as an excess too strong problem or too weak problem. We're not talking about that, right? But in other strategy, if you can tell, okay, this is the organs, lung organ, weak deficiency, then the meridian will be still the same, but the point is different. We choose the point on the lung meridian, we choose the mother point, and we do tonify technique. So that's different. Again, how come to your diagnose? If you diagnose more into weak and excess, then you need to, according to your diagnose, and needle your patient. If your diagnose are not coming to weak or too strong, the organs, then you don't have to worry about that. You just do magical pop. You just do 5 neck point. Okay. So there are many strategies. Okay. Oh, good. That's correct. Szenan, George say that's correct. Szenan. That's I like to check review graphical data along with diagnosing. Yeah. I would suggest that. It's a severe one, and they have it's a chronic one. If it's just they know the play is they didn't get any bad attack contact from sport, and they just wake up in the morning and I have pain in the neck, and we don't normally go and get a X-ray or MRI, right? We give them treatment first. If it's good, that's good. If that problem's still ongoing, keep coming back, then we will get further, because there might be arthritis in there, there might be a spur in there, right? And our process is we don't straight away get patient to go, hey, everyone get X-ray. No, we don't do that. We give treatment first. We give the physical examination first, right? So it all depends on how you examine the patient and how you think of the patient. Is it serious, severe pain or not? Okay, not everyone need an X-ray or MRI. When it's severe and there's a spot injury and very heavy attack on the neck, then they suffer from neck pain, I would get them to get some, if they have tingling numbness symptom or dizziness, I would straight away go for MRI scan or CT scan first. I'll give you some needle, but I need that too. Right. Something like that. If you mean Mexico, it was a prison for my master. Okay, great. In neck pain, lower channel can be used as well. Yes, of course. Lower yuan can use in anything. It can use in anything. It's a point strategy, but it's all about how you diagnose it. The diagnosis is very important. Okay, I think we'll in here today. It's come to about an hour now, or 45 minutes right now. So stay awesome, and I love you all, and I'll see you tomorrow. We're gonna talk about what can you do at home with your patient. What can your patient do at home? If you're a patient, you suffer from neck pain, or your friend, your family suffer from neck pain, then tomorrow's topic is very valuable, because I'm gonna show you what you can do at home, and what acupressure point that may instantly relieve your neck pain. Right. So stay awesome, and I love you all, and thank you for being here with me. Thank you very much. See you tomorrow. Let's end all the video. Thank you, Veronica. If you in this life, you